All right, I think we've gotten started. Hello, everybody. Welcome to LAIVF, our webinar lunchtime series. And today we will be talking about egg freezing and whether it's a good option for you or not. And I am here with Dr. Akut Bayrak, who is the medical director of LAIVF, and our fertility specialist who will be speaking today about egg freezing. Hello, Dr. Bayrak.
Hi, Erba.
Hi. So I want to let our listeners know that please ask any questions at any time. I have a chat column here, so if I see your question, if you type it in, I can ask Dr. Bayrak when we get a moment. We have a few people in our chat room today, so thank you for joining us. And Dr. Bayrak, if you don't mind, if we can start off with just a brief introduction about LAIVF, and then we can also get started with egg freezing.
Of course, no problem. So LAIVF is a complete full-service IVF clinic. We are located in West Los Angeles, Pasadena, Chino Hills, Inland Empire, and San Diego. So we have 4 locations. We have 3 physicians within our group, we do everything in-house. We have our own IVF laboratory. We have our own California licensed tissue bank. We also have our own surgical center where we do outpatient procedures. We do freeze eggs, do IVF. Those are the main services that we provide. We also provide PGT, pre-implantation genetic testing, to vast majority of our patients, as well as anything related to male infertility, as well as fertility preservation for whatever reason it might be, which is, I think, what we're going to talk about today, primarily about egg freezing. When patients come in, they typically see us from the start to the end. They're typically with one physician, and that physician does all the ultrasounds, procedures from start to finish. That we believe gives the patients a better attention, continuity of care, and overall just simply better care. So, and then we'll talk about egg freezing in just a few seconds, minutes, I guess.
Okay, great. Thank you for that introduction. And in particular, what I want to cover in our talk about egg freezing is, of course, the definition. What exactly is it? And I also want to cover who should freeze their eggs. When is a good time frame? What age is the best time to freeze your eggs? And a lot of questions that we also get are, is how many years will our eggs last once we go ahead and freeze them?
Right. So let's talk about egg freezing in general. Egg freezing refers to basically freezing the eggs at a time so that they can be used later. The process of egg freezing has been around since the 1980s, actually. So it's been around for a very long time, but the techniques have really not been perfected up until probably about 10 years ago. Recently, in the last 5 years or so, the American Society for Reproductive Medicine removed the experimental label of egg freezing. So it is no longer considered experimental, which it was almost like 10, 15 years ago. So this is a relatively new technology, new technique, and a method that we use to preserve fertility. So those eggs can be used later on for whatever reason it may be. And egg freezing has come a long way in the sense that when eggs were frozen in the late 80s and 90s, especially in the 90s, and then even in the early 2000s, you would be able to freeze the egg when you thaw the eggs, they would not survive. And the reason for that is the egg is a very large cell that has a lot of liquid in it, a lot of water in a way. And when you freeze the egg and then you thaw, and if you do that without dehydrating the egg or removing the water or the liquid, these ice crystals form within the egg, which then damage the egg. And then when you thaw the eggs, they do not survive. So quite a bit of research has gone into egg freezing, which I was lucky enough to be a part of in the early days of egg freezing. And we did publish those papers in the 2000s about egg freezing, how it should be done, and what are the consequences and outcomes and potential risks and issues associated with egg freezing. So when the key with egg freezing is really to freeze the eggs when the eggs are healthy. So the common question is, when should I freeze my eggs? Should I freeze them when I'm 25, 35, 45? Never freeze them? Like, when should I freeze the eggs? There is really no exact age that we tell the patients that they should freeze the eggs. So there's no cutoff, like 35 or 32 or 38 or 40. There's absolutely no cutoff, which means if somebody comes in at age 32 versus 38, and if they want to freeze their eggs, I think a reasonable approach is to explain the process, some of the challenges, the benefits, alternatives, and the outcomes of those alternatives, so that the patient is informed and then they make the decision themselves based on their understanding of the process and whether it's a good time for them individually to freeze the eggs. So somebody may come in at age 30, and if they had endometriosis in their 20s, if they had pelvic surgery, if they had pelvic infections, or they have heavy menstrual bleeding, they have fibroids, or somebody in their family has a history of early menopause, if they have other medical disorders, or if they have some level of subfertility in the past, those patients should freeze their eggs right away, even though they're very young. So we just cannot say that somebody at age 30 is way too young to freeze eggs, because that person may have other risk factors that would dramatically increase their risk of having abnormal eggs, or a potential to have infertility or decreased ovarian reserve in the near future. Whereas somebody may be at age 35 or 36 who may be at minimal risk, and that person can potentially be followed for another year or two. So just by the fact that somebody's 35 doesn't mean that they must freeze eggs. Whereas the other flip side of the coin is also true, where somebody may think that they're 28 or 30 and they have all the time, but they don't. So that's why when you're concerned about your egg reserve, or when you're concerned about having a baby in the future, or you believe you may have risk factors, or you just don't know simply, the best thing to do is to reach out to a reproductive endocrinologist, otherwise known as infertility specialist, and at least get counseling, have an understanding of your risk factors, which we can identify, and we can even further test just simply by a blood test and an ultrasound, which does not take more than 10 minutes, to determine that person's egg reserve and the risk factors. And then based on that assessment, then we come up with a risk level for that person. Are you at low risk? Are you at high risk? Are you just at age appropriate risk for having, fertility issues or losing your eggs at that age, and whether you should freeze your eggs or not? And then we make a recommendation based on that. So I think just giving an age, simply a reproductive age or chronologic age, would not do us justice, because we'll probably either over or under treat some of those patients just based on one variable. There is some truth, obviously, that fertility goes down over time. And so the longer we wait to freeze eggs, obviously that's not good. So that's common knowledge. So if somebody comes in and says, well, I'm 38, should I wait for another 5 years? The answer is no. You shouldn't wait for another 5 years, because when you're 43, your egg reserve is going to be dramatically lower than what it is today. So that person, if that person is single and she wants to stop her biological clock, then certainly egg freezing is one of the options. The other things that we typically recommend to patients is fertility preservation is it's kind of a wide, broad term where when we just talk about egg freezing, I don't think we're doing the justice to the patient. So fertility preservation also involves modification of lifestyle, elimination of bad habits like smoking, excessive alcohol use, not sleeping well, traveling too much, using drugs, using prescription medications, or having medical issues that have not been treated, managing sleep disorders, having adequate level of sleep, keeping a balanced diet. So all of these also go into the counseling that we do at LAIVF as a part of fertility preservation. Because if somebody's smoking, she's going to go into menopause at least 3 to 4 years earlier than average, which means she's going to lose her eggs at a significantly younger age compared to somebody else in that age group. So if somebody's smoking and we help them stop smoking, that's fertility preservation right there. We just preserved her fertility, right? Or we delayed the onset of infertility for at least 3 to 4 years. Somebody's drinking excessively, 2 to 3 drinks every day. If we can manage that, then we automatically did fertility preservation for that person. But if somebody has no risk factors, everything is fine, and she's just single and concerned about it, or she's pursuing a career or something else, then egg freezing certainly is helpful. It doesn't guarantee the outcome, though. That is something that the patients need to know. Patients may freeze their eggs. 5 years later, they may come back. That may not yield a successful outcome. So egg freezing does not guarantee outcome, which is extremely important. Obviously, the techniques are very advanced now, and if we can get a good number of eggs to freeze when we thaw them, fertilize them, create embryos, most likely they're going to have a baby. And the success rates are very, very high, but it's not still guaranteed, unfortunately. While we're on the success rates, let's talk about numbers.
Okay.
So in general, we would like patients to freeze about 10 to 15 mature eggs. Once again, we would like patients in general, once again, just in general, there are obviously a lot of exceptions to the rule, but in general, we want them to freeze 10 to 15 eggs. And the reason for that is, once again, in general and just on average, once again, just on average, about 80% of the eggs will survive the thaw process. And of those, 80% will fertilize. And of those that fertilize, about half of them will not develop to the final stage. So if you have 10 eggs frozen, you thaw them, once again, on average, 8 will survive. Sometimes we have 100% survival where they have 10 out of 10 eggs. Sometimes we have 60% survival where they get 6 out of 10 eggs, right? So it all depends on what we're freezing, how we're freezing, and how we're thawing. So, but on average, let's just throw out general numbers so people have an understanding of what they may be looking at. So out of 10 eggs, you get 8 when you thaw. When you fertilize, you go down to 6. And then after about 5 days of culture, you may go down to 2. And that may just be enough for 1 or 2 kids. It's just that if you don't do well and you're below the average, or if your egg quality is not good, then you may only have 1 embryo, or that may not even be enough. So that's why it's a numbers game, regardless of what we do. And it's just, I think, important to understand those numbers. What also is very important is what we freeze. So sometimes patients come in and say, well, I have 5 eggs frozen, and that's probably enough. And that may be enough, by the way. 5 eggs, if they're all good, or if there's, at least half of them are good, then you're probably done. You don't need to freeze more. It's just that because it's unpredictable, and when we thaw those eggs, which ones are going to survive, how they're going to look, we like to have some kind of a cushion in a way so that we have at least a good number of eggs. Even if you lose average or below average, we want to make sure that we at least have 2 or 3 embryos to offer to the patient for transfer. We obviously don't put back all 3. We only put back 1 at a time. But if somebody has 2 or 3 embryos, after freeze, thaw, fertilization, and development of those embryos, then I can freeze the structures as embryos at that time, and then only transfer 1 embryo back into the uterus, which will then give us a backup plan. But overall, egg freezing typically results in approximately 50 to 60% pregnancy rates each time we do the transfer. That's not 50 to 60% lifetime or per try or per attempt, but rather per transfer. So if you end up with 1 or 2 transfers, that's 50, 60% per transfer, which is I think pretty good. Once again, it's not 100%, certainly, but it's almost up there. In terms of the risks, patients will inject hormones. Obviously, we don't believe they cause long-term consequences or risks or increased risk of cancer to our knowledge, especially in somebody who does not have infertility. Because if somebody has infertility, that patient will be at risk for certain types of cancers, regardless of treatment. So if somebody has an infertility diagnosis, that person is already at a higher risk for developing ovarian cancer, for example, and we know that. But the use of injections or fertility medications typically do not increase that risk further. And then there's the egg retrieval procedure where we aspirate the eggs vaginally. Everything's done from below, so there's no surgery from the abdomen, and that's a very, very, very low risk procedure. Risks include bleeding, infection, pain, but beyond that, it's very low risk. And then in terms of the storage of the eggs, we store them in-house at our own licensed tissue bank, and they don't age, which was one of your questions, I think, that the audience wants to know. There's no expiration date. They're in liquid nitrogen, and their metabolism stops. So whether they come back in a month or 10 years, eggs stay the same. Great. Which is the beauty of this technology, because when you freeze your eggs at age 35, you come back at age 42. Eggs are still 35 years old, even though you're 42. And the risk of having a baby with birth defects and everything else is based on your age that the eggs were frozen at, not the age that you're carrying the pregnancy. So overall, egg freezing is very successful. We actually did the first egg freezing case in California from an egg that was genetically tested and frozen back in 2009. I actually treated that patient myself, and the baby was born, a healthy baby girl was born in 2010. So we actually reported the first case in California from such a treatment. So we're certainly proud that we did that. And over the years, we had a number of patients come through our clinics, froze eggs, and came back and had babies born. So I think that's probably what I would talk about egg freezing. You know, we can go on and talk about egg freezing for hours, but I know we have very limited time. And let's see if there are any questions from people in the chat, and I'll be happy to answer them over the next 5 or 10 minutes. And after that, I think we'll close the session for today.
Okay. If anybody has any questions, please feel free to jot them in the chat. I do have one last question myself, which is what I promised we would cover, which is cost effectiveness of egg freezing. And let's say for a scenario of a woman who's 30 and she freezes her eggs, she may or may not necessarily need to use those eggs. Maybe she's 35 and she tries to 35 or 40 and tries to conceive. She may get pregnant on her own. If she does not, then she would also have to go through the IVF procedure also, in order to use those eggs, utilize those eggs, essentially. So I just want to make sure we cover that, because I know that that's a topic that's often asked about.
Right. So the cost analysis is very difficult to complete in a way, because somebody freezes their eggs at 30 and they may get pregnant at 32, right? So then they didn't need egg freezing. Or at age 35, they have an ovary that has a cyst or endometriosis where they lose one ovary and the other ovary has cyst and they remove half of that ovary, or they have an infection or some kind of medical disorder, or genetically they have accelerated loss of their eggs. In those scenarios, then egg freezing becomes dramatically cost effective, because if somebody has low egg reserve, then they'll have to do multiple IVF cycles, which will probably be about 5 or 6 times more than egg freezing cost. It's very difficult to tell an individual patient what their cost effectiveness will be, because we don't know what's going to happen in their future. We cannot predict the future. But certainly, if somebody is freezing eggs at a reasonable age and they have good egg reserve at that time, and then they come back in the later years with low egg reserve, which would then necessitate for us to use those eggs, then it becomes highly cost effective. There's no doubt about that. But some of the patients never come back. They freeze the eggs, and either they don't want to have a baby, or they get pregnant sometimes and they're just happy with one kid, or they get married late, but they just simply don't desire fertility. So some of those patients freeze the eggs and they don't utilize them. Certainly we have patients like that as well. We also have patients who come in, they use their eggs, they get pregnant, and they're extremely happy. Otherwise, they would have not gotten pregnant had they not frozen their eggs. So that's a difficult kind of calculation for each individual case, but certainly one that has to be, I think, covered and discussed with the patients.
Correct. So it's discussed on an individual basis, and it's kind of like an insurance policy almost, where
Right. So exactly, it's like an insurance policy. So you pay for insurance, and then you don't need it that whole year, or the next year you don't need it, and then 5 years later you break your arm or you're hospitalized, and the hospital bill is $150,000 that you have to pay, but your insurance covers that because you've been paying for insurance. So it's saving for the rainy day. So the same thing applies to egg freezing. You don't really know if you're going to need it, but when you need it, and you want to have that flexibility. So that's, I think, a good way to look at it.
Okay. And I don't see any questions in our chat room. So I think this would be a good place to go ahead and close our webinar for this afternoon. I want to say thank you to everyone who has joined us for the webinar, and remind you also that if you have joined our webinar, you will receive a free consultation with Dr. Bayrak, and please contact me, and I will through our emails, and I will go ahead and connect with you on that. And thank you, Dr. Bayrak, for explaining egg freezing. That was super helpful. And we will see everybody next month. We are having a seminar with Dr. Jeffrey Scher on January 25th and January 26th. That's a Saturday and Sunday. And I'll send a link to that seminar if you'd like to join us, and you can come to our website, and our link is on the front page of our website, so you can go to that as well. So thank you so much, and have a wonderful afternoon.
Thank you.
Okay, bye-bye.